Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, a grim milestone in our fight against COVID-19. The country passes more than 1 million cases as the Health Department reports 8,000 new infections on Monday. The COVID-19 Interagency Task Force is set to meet today to discuss next month's quarantine classifications. Should the government keep its current rules or ease restrictions? And the Philippines mulls banning flights from India over a new COVID-19 variant first detected in the South Asian country. Health Secretary Francisco Duque joins us live. The COVID-19 Interagency Task Force is expected to meet to discuss its recommendations for next month's quarantine classifications. The IATF says the strict lockdowns the past weeks have worked in lowering the number of coronavirus cases. But despite some improvements, the task force wants to make sure that gains won't go to waste. Let's go straight to the source of the story. We have Health Secretary Francisco Duque. Secretary Duque, welcome to the source and maraming salamat po sa inyong oras.
Well, thank you very much, Pinky, and thank you for the invitation on behalf of the DOH and the Interagency Task Force on the Emerging Infectious Diseases.
In an interview yesterday, Secretary Duque, you said that if it was your choice, you would rather extend MECQ for another 1 or 2 more weeks. Do you still stand by this recommendation when you meet with the IATF later?
Yes, Pinky, that's still my personal stand.
Why did you come up with this recommendation, Secretary?
Well, I was proceeding from the fact that the average daily attack rate, and we're talking about NCR, of course, no, plus bubble, the average daily attack rate has not gone down to a moderate risk level. It's still a high risk at more than double digit pa rin. I think it's about 19 to about 30 plus average daily attack rate per 100,000 population. So that's number one. Number two, my basis is also the ICU utilization rate is still classified as high risk. Although it has significantly gone down from an 85-86% ICU utilization rate down now to about 71%. So it's 2 points or 2 percentage points short of moderate risk classification. And that's what I want to happen, to bring it all the way down to moderate risk classification of the ICU, ICU, pinag-uusapan.
Okay, but what has been your assessment the past 2 weeks of ECQ and almost 3 weeks of MECQ? What were our gains so far?
Well, the gains are very clear, no? We've brought down, as I have said, the NCR ICU utilization rate from about 85-86% down now to about 71%. The hospital overall isolation, ward beds, isolation beds, MEC beds is now down to 62%. No? That's about 6,308 utilized beds over a 9,600 plus capacity. So that's equivalent to about 62%. And then our TTMFs, no, we have also brought it down significantly. It's now at 72%. This includes our mega temporary treatment and monitoring facilities in Metro Manila. And I'd like to thank Secretary Mark Villar for his very aggressive ramping up of our TTMFs, isolation and quarantine facilities in the NCR.
So do you think, Secretary, that you will have the support of the other members of the IATF in this recommendation of yours to extend MECQ to 1 or 2 more weeks? And where would you rather go? Would you rather go just 1 more week or 2 more weeks?
Well, it depends. I need to have the benefit of the data analytics report, which will be presented in the IATF meeting this afternoon. So kailangan natin ng sariwang mga datos, no? So that this can guide us whether my personal position of extending MECQ for another week is well grounded, or if it should be extended by 2 weeks. So it really all depends on how the data will look like later during the presentation. What we need to watch out for are essentially the 3 metrics, no? And the intensified implementation of our prevention, early detection, isolation, treatment strategies, no? Underpinning our pandemic response. So I talk about the 2-week growth rate. The 2-week growth rate shows very positive signs in the sense that the transmission rate has slowed down, and in fact, the change has been at -15 for NCR, no? 2-week growth rate, no? Compared that means the cases for the current 2 weeks are now lower by 15% compared to the cases of 3 to 4 weeks ago. Okay. Mm-hmm. Now let's shift to average daily attack rate. We need to bring down the ADAR to less than 7 new cases per day on the average per 100,000 population. We're now at double digit. So that's one thing that really makes me I find very difficult, no, to ease down to a GCQ because the ADAR, mataas pa rin yung ADAR. Okay? And then of course, the CUR, malaki na rin na improvement natin, but we need to bring it further, at least by 2 percentage points, no, to about 69, and lower, better still lower, to merit a moderate risk classification. And of course, the usual, our early detection. Our early detection is very important through active case findings, surveillance of influenza-like symptoms. Kailangan hanapin talaga mag-Daravi model, na hanapin talaga sa mga communities, bahay-bahayin ito ng mga barangay health emergency response teams, to look for people with symptoms. Kahit na hindi pa natetest yan o naantay mo pa yung test, importante isolate mo na kaagad. That's the key. You need to identify through active case finding and then aggressively isolate. And then that's when you test, and then you contact trace, and all of these sequentially, you want to do it in 70% or more of those identified or detected within 24 hours, of detection or onset of symptoms. Kailangan ma-isolate ka agad. So that way, you're able to cut the chain of transmission.
Yeah, and would you say government failed in doing that when we discovered the South Africa and UK variant, right before we went into ECQ?
No, I think the government, through the task force variant, which the president directed the IATF to constitute, did a good job of its biosurveillance. The Philippine Genome Center, we are benefited by its continuing biosurveillance, and the whole genome sequencing has helped us identify and characterize these variants, the UK variant and then the South African variant. Kaya naman, if you look at it, although it really is associated with increased ADAR, average daily attack rates, with these variants, we've managed to keep the percentage of these variants relatively lower than expected. Because up to now, ang ating dominant variant is the Hong Kong lineage, at 20%, which is the B1163, and then followed 13% UK variant, and another 13% South African variant.
Yeah, but would you submit, Secretary, and educate us on this, that even the South Africa and the UK variant, we are not doing enough tests to actually find out how much of it is really prevalent already here in the country?
Well, as I've told you, we had a modeling that was done, and PGC has shown that there is a correlation, in NCR spikes with the presence of both variants, South African variant and the UK variant. Okay, but is this the only factor? No, definitely not. There are other factors that have contributed to the recent spikes. No? Although we've seen a downward trend, the rate by which the reduction is observed is not enough. We need to push it even more downwards. No?
Yeah. So we're actually talking about the original variant, Secretary, the UK variant, the South Africa variant, and now there is this Indian variant. I want to talk about that after the break. But before we do so, Secretary, para lang po malinaw, ano ho ang inaasahan yung mangyari kapag ma-extend po ang MECQ ng isa o dalawa pang linggo? What do you want to see happen?
Oh, well, we want, as I've said earlier, bring further down the utilization rate. ICU, we are focusing on ICU because it is the ICU capacity that saves lives, no? More than anything else, more than TTMFs and more than the other capacities in the hospitals like isolation and ward beds. No? So ICU talaga, ICU. So
Okay.
yun ang pinagtutuunan natin ng pansin. And of course, the intensified PDITR implementation. No? Yung contact tracing natin, as I've said, time and again, I want to thank Dole, Secretary Bello, for contributing 4,000 and another 5,000, which he intends to do to the contact tracing capacity of NCR.
And we need to talk about that too, the ICU bed. Let's find out the state of the ICU beds. After the break, this is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Secretary Francisco Duque. Secretary, this Indian variant, is this a cause for concern?
Well, it's the B.1.617. And the Philippine Genome Center has not reported to the IATF whether this has evolved to become a variant of concern. So it is still considered as a variant under investigation. And the same is true with the WHO take on this particular Indian variant, which is not confined to India. In fact, they've been discovered also in many other countries. I think about 21 countries in all.
So some of them, I believe, is the United States, Australia, and even Singapore. But do you want to be able to preempt the possible entry, if it hasn't entered the country, of this Indian variant? Are you looking at the travel ban, sir?
Well, there's already a travel ban of foreigners from coming in. So we will take this up also in the IATF. The matter of our OFWs or ROFs, returning overseas Filipinos, who might be coming from India. But the latest data show, according to OWA, when I spoke to him last night, there are only about 1,200 documented OFWs in India. But having said that, a stricter border control is always something that we have done and considered to intensify.
So if we are looking at 1,200 overseas workers in India, I didn't get that quite clear, sir. Is there a travel ban now from India?
There's none from our OFWs because the policy has been all OFWs, ROFs, upon the directive of the president, must be allowed to travel back home. And so
Okay.
we just, of course, requested the president about 3 weeks ago to limit the entry to about 1.5, so we can manage more comfortably for the OFWs the isolation and quarantine facilities, such as the hotels,
I
accommodation.
understand. So wala pa pong travel ban, obviously, as you mentioned, of the overseas Filipino workers coming from India. What about even foreigners from
We'll take it
India
up. We'll take it up
coming to
mamaya.
the Philippines?
I think, as I've said, we have banned travelers, foreign travelers, no, from coming in. So the issue on the OFWs will be taken up in the IATF upon the directive of the Office of the President.
Okay, but for now, what would be your recommendation, knowing that there is an Indian variant? Do you think that it would be wise to impose a complete travel ban, sir?
No, I think what is more important at this point is to ensure that the strict quarantine protocols are followed. Okay, so like our OFWs, ROFs, no, and even those other groups of kasi may mga exemptions tayo ginagrant, no? Yung mga diplomats, etc. They all follow the strict isolation and quarantine protocols. So if they're symptomatic, they're tested, and if they're positive, they're made to complete a mandatory 14-day isolation. And for those who are asymptomatic, we test them on the 5th day or 6th day post-arrival.
Right.
And then if they're negative, there's a proper turnover to the LGUs to continue the remaining quarantine period. So in Singapore, they're doing a 21-day quarantine period, no? So more stringent. We can also look into this. Pero ang problema nga natin, yung mga hotels natin at some of our quarantine facilities na binaungkad na.
Okay, so as is po muna tayo. That's basically what you're saying. Let's move topics now. Secretary, hospital utilization. A number of hospitals, sabi mo nga, ICU. Ito dapat isa sa mga bigger focus ng gobyerno. And it's still in critical level. I remember an interview with PGH saying that yung ER po nila is full. Okay, granted. Yung ICU din po is also full. And in fact, they said that, if I'm not mistaken, there are about 5 to 10 patients who die every day. I can't imagine what that's like, sir. When do you think, kailan ho ba? Kasi sabi niyo nga ICU ang dapat bigger and stronger focus. When do you think it will happen na hindi po puno yung mga ICU natin, or even isama ko na rin po yung mga emergency rooms?
Well, as I've told you, we have managed to bring down our ICU utilization from 85% critical risk level now to about 71%. No? It's a 13, 14 more or less percent reduction. So this represents about 150 additional ICU beds, no, in the public sector, in the public hospitals, mainly the DOH retained hospitals. Now, we met with the representatives of the biggest private medical centers in NCR, and they've committed to provide additional 164 beds to about 172 beds for ICU. So once we are able to get that and realize this, hopefully much of it within the week or until next week, we should be able to comfortably bring down our ICU utilization rate to about less than 60%. And that will mean it will be at the safe zone or low risk classification. So there will be enough reserve capacity.
Basta pumunta po dun sa 60%, nandun na po tayo sa tinatawag na safe. But quickly, let's jump into the ERs, of course. Puno pa rin po yung mga ER. There was also a report doon sa NKTI that there were actually patients at po yung mga kanilang mga kasama, kapamilya o na nagmo-monitor sa kanila, natutulog na po sa labas ng NKTI outside the ER because nga they are waiting to be admitted sa ER. What is the plan, at least for NKTI, sir?
Well, ang Philippine Red Cross, I'd like to thank the Philippine Red Cross for promptly setting up tents, no? Very functional, air-conditioned tents, no? To accommodate more patients who have fallen in line, pero yung mukhang dumadami yung mga tao sa labas ng ER kasi naman sabi ni Dr. Rose Niquete, yung mga kasama dumadagdag doon sa scene na maraming tao, but of course they've been very careful to manage and to make them observe the proper distancing, no, and minimum public health standards. But again, going back to ramping up the capacity, I think there are several tents that have already been set up in NKTI. You can probably send your reporters to check on this, and also in the Lung Center of the Philippines. So the increase, I think baka yan na yung mga tents ng PRC, no?
Yes.
But usually may nakalagay PRC.
Yeah, we actually
this is
spoke
on
to
top
Senator
of our
Gordon about that.
tents. Yes.
Opo.
That's right.
We nakausap nga namin si Senator Gordon dyan. Yung sa NKTI was very recent. I think that was just about 2 days ago. There were 9 other tents, I believe, in Lung Center, if I'm not mistaken, or East Avenue, na naglagay din ng tents ang Philippine Red Cross. That was about 9 to 11, and they're also helping in the isolation. So, Secretary, I hope you don't mind, we take another short break. The source will be right back. Secretary, there's still a lot of issues. Papasadahan ko na po ito. First is that the FDA again granted a compassionate special permit to 2 more hospitals to use ivermectin. So far, that's a total of about 5 hospitals who have received this permit. Just tell us, Secretary, what is your personal thought on this, on ivermectin, on the use of ivermectin?
Ivermectin kasi ako talaga, I'm just waiting for more data. And the best provider of this data is the WHO because it's the repository of clinical trial results in different countries. No? And so we are guided by the WHO's advisory on ivermectin. But this is not to preclude us from holding our own clinical trial on ivermectin. And that is why in response to the President's directive, the DOST has already laid out its ivermectin clinical trial use for humans. No, the plan is already there, so they will just have to organize, and I think they've organized it with the DOH and the LGUs or the hospitals rather than the LGUs. The hospitals that will conduct the trials, and presumably this will be done on mild cases, those who are in isolation right now, to see if ivermectin, as purported, has beneficial effect in treatment and also in terms of prevention. No? So this is what the hypothesis or the theory that they need to prove through the conduct of clinical trial studies.
And also, Secretary, we reached the 1 million mark yesterday. Ano po? While majority of that are mild or asymptomatic, we cannot discount the possibility that thousands have died due to COVID-19. Senator Nancy Binay in an interview described the government's response to the COVID-19 pandemic as a failure. How do you feel and what do you say now that we have actually reached 1 million cases?
Well, the 1 million cases can be viewed also from a different angle. No? That we're also going to sooner than later reach 1 million recoveries. No? So I think we have to focus as a nation on how we can further improve our pandemic response. There are always ways to do things better. No? I'm not saying that we are successful, we are like this, like that. But I'm saying there's always an opportunity which we grab each time to do things better. No? And so what is important now is that we continue to see that the active cases, about 77,000 in all, 96% are mostly mild and asymptomatic. And about, the remaining would be moderate, and hopefully there's severe to critical cases are in check, below 1% of the active cases. So we have to look at it from the more optimistic lens of getting a very high recovery rate at more than 90%.
Okay, again,
and so we continue to ramp up.
Go ahead, Secretary.
I said we continue to ramp up our health system's capacity precisely to match the caseload, so that people will be more comfortable in the facilities which are appropriate to their clinical manifestation. But as I've said, the focus has to be on the ICU, because that is what really takes care of severe to critical cases. And I thank the medical community, our doctors, our nurses, everybody that has contributed to the outcome of better clinical management, and for saving lives, of many of our patients. And the whole country salutes them for their unwavering effort, their unflinching dedication to care and to save lives. And that is why we have managed to keep our case fatality rate at about less than 1.7%.
Again, when Secretary Duque talks about the severe and critical, which would need ICU care, we're looking at about 2% of the cases that is recorded daily. So if we have an average of right now, let's say 9,000 cases, Secretary, that would be about 180 severe and critical cases on a daily basis, sir, kapag magpatuloy po tayo sa ganong klaseng average of infections daily. Health Secretary Francisco Duque, sir, we've run out of time, but maraming salamat po sa inyong oras.
Oh, thank you very much, Pinky, again, in behalf of the DOH and the IATF, for the opportunity to share with you what we have done so far in our overall pandemic response. Thank you very much.
Take care of yourself, sir. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.